Thank you, Ryan. And I just want to reiterate really quick, what we're talking about here is we're talking about the state of Illinois is currently failing on so many levels, right? We're not helping children that are in harm's way. We're not providing the services needed for the developmentally disabled. We're not providing a number of services on a number of levels. We're underpaying hospitals right now that are struggling. And I just want to go through how we got here. I'm State Representative C.D. Davidsmeyer. I represent the 100th District, a large rural district just west of the Capitol here. This has not been a thoughtful process. During the 2020 pandemic, the shortened session that we had during 2020 where we spent some time in the Bank of Springfield Center, at the last hour, they added health care benefits for undocumented immigrants, seniors, in the 2021 BIMP. These new benefits were included in the BIMP, which is the Budget Implementation Bill. At the very last minute, we had little to no time to review what was in it, and it passed at the end of that special session. Then in 2021, Democrats again slipped expanded health care benefits for undocumented immigrants ages 55 to 64 into the fiscal year 2022 BIMP. This again was included at the last minute. Little thought, little information on what the cost was going to be, little to no information, no committee hearing, no access of the public to make comments. Then last year, the Democrats blew up an agreed Medicaid omnibus bill by yet again adding more of the health care benefits for undocumented immigrants for ages 42 to 54. Once again, no hearing, little debate. Let me be clear that none of these taxpayer-funded health care benefits or expansions for undocumented immigrants were debated or voted on as standalone bills. They were not discussed in committee. They did not go through the process. The only way they could pass was to slip them in the middle of the night in BIMPs and failed promises on Medicaid omnibus bills. The public and the General Assembly were given no time to review or comment. As we speak, House Bill 1570 has been proposed and is sitting in Medicaid and Managed Care Subcommittee. This bill would complete the expansion of health care benefits for the undocumented population by adding ages 19 to 41 to the program. Like before, House Bill 1570 has not been debated, standalone. If recent history is any guide, we should be concerned and we should be watching for what's going to happen in the upcoming BIMP, or if it's going to be slipped into some other random bill in the middle of the night that we're going to be forced to vote on in the last minute. I serve on the House Appropriations Committee, Health and Human Services Committee. It's a huge committee. It's a huge portion of the budget, as was discussed before, and so I think it's a very important part of the budget. This is meant to serve people who cannot serve themselves. During a hearing on March 16th, I specifically requested information from HFS about these repeated expansions, about the cost of these expansions, and they said they would get back to me. I've heard absolutely nothing. Crickets. As was mentioned on March 31st, HFS quietly released a report on updated enrollment cost estimates for healthcare benefits for immigrants here illegally. Let me say this. The estimated cost of health benefits for the undocumented immigrant adults will skyrocket to nearly $1 billion in fiscal year 24. That $1 billion cost does not include this final expansion of 19 to 41, ages 19 to 41, proposed by House Bill 1570. None of the costs, once again, none of them are matched by federal funds. Illinois taxpayers are on the hook for 100% of this cost. We all support the idea and the goal of providing health care, reasonable cost health care to the people of the state of Illinois. We want to make sure that hardworking families are covered by good health care. We want to make sure that seniors on fixed incomes are covered. We want to know, and the people of the state of Illinois deserve to know, how their tax dollars are being spent. The sad fact is that Illinois has become a sanctuary state for undocumented immigrants. The state of Illinois gives them free health care benefits, driver's licenses, mortgage and renter's assistance, as well as other taxpayer-funded benefits. All I can say is, if you build it, they will come. As we saw, the shortened expectation, the overrun after merely a month of the new program coming in, I think we will continue to see that, and the nearly $1 billion that we're currently spending and possible more expansions will quickly outgrow the expected costs. So we need to do something right now to control this and to make sure that the people of the state of Illinois, the taxpayers in the state of Illinois, know how their dollars are being spent and they are receiving the services that are already promised today before we start expanding programs for individuals who are not Illinois citizens.